Let's see. Okay, so it's recording now. So hi, Dr. Little, if you'd just like to introduce yourself and your program to get us started.
Yeah, I'm Andy Little, and I'm the current program director at the program at AdventHealth East Orlando, here in Orlando, Florida.
Okay, great. Just a little icebreaker.
hmm
What movie do you wish you could watch again for the first time?
Ooh, for the first time, it's got to be Jurassic Park. And I'm not saying that because Universal's close. I remember that being the movie that got me interested in movies. I was 11 or 12 when it came out. Went with my brothers and a couple buddies. Rode our bikes to the movie theater, in rural Montana, and went and saw it. And it was as amazing as I remember it. If I could have that moment again, I'd love to go back and do that one.
That's awesome. That's
Yeah,
like a great series of movies. I mean, I
yeah,
didn't like grow up with it, but I still was able to watch all of them and I love
yeah,
them.
yeah. They're really good.
Yeah. So another question, what does a successful resident at your program look like?
Yeah, this is a great question. This one always is one of those where I think a great resident in any program, but specifically in my program, is someone who's willing to be honest. And I'll explain that here in a little bit. So, what honest means is you're honest with yourself in in your deficiencies and things you need to work on, which means you'll be honest with me as a program director or a faculty member when you need help. You'll be honest with patients and when you talk to them and communicate with them, and then you'll be honest with me when we talk about patients. And then all that honesty means you'll get increasing responsibility, you'll get increased education, and then you'll get increased trust that allows you to grow up and be the best emergency medicine physician possible.
Awesome. Great.
Yeah.
Um, how can applicants stand out and what do you look for in students who are on audition rotations with you?
Yeah, I think the two-part question, what makes people stand out is people who are really into emergency medicine. Not that we love getting people that want to convert late, that late third year, early fourth year conversion. But if you're in emergency medicine, I want you to be all in. I want you to be involved in organizations. I want you to have done a little bit of scholarly work. I want everything about your application to say, hey, I'm a high functioner and I want to be involved in emergency medicine. And then when you're actually on rotation, I mean, it's a lot of the simple things. It's show up early, it's leave late, it's be courteous, it's communicate well. Again, it's be honest when you talk to patients and when you talk to me about what happened with patients, and then be willing to go the extra mile and always be available to help.
Okay. And then kind of going back on that question, if there was a student who got interested in emergency medicine late, so they don't have time to do
Mhm.
some of that stuff to their application, what would you suggest to them?
Yeah, I think it's find a way to, find a way to show your interest. So whether it's, reach out to programs on social media, attend their hangouts that happen before recruitment, maybe try to go to an EM conference and get some FaceTime with people. There's a lot of opportunities to get some small scholarly work, whether it's in images in emergency medicine, an abstract, or go to one of the speaking competitions at numerous conferences, whether they're local, state, regional, or national. So just find a way to do that last little bit to kind of show that, hey, my application might say I'm all ortho, but now I'm emergency medicine. And so just find a way to kind of delineate the line in the sand of when you switched and just do some of the easy work.
Okay. And then also, is your program a 3-year program, a 4-year program?
Yeah, we are a 3-year, 8 resident per year program based in a community setting here in Orlando.
Okay.
Yeah.
And do you have EMS or pediatric experience throughout the process, or how is that kind of put
Yeah,
in?
we're lucky that AdventHealth for Children is one of the large pediatric hospitals here in town, and our residents get to do a month of emergency medicine and their PICU month there. And then your second and third year, you have a longitudinal pediatric emergency medicine curriculum. And then on top of that, we're lucky that here at East Orlando, about 20 to 25% of our patients are pediatrics. So you're going to get a ton of pediatric exposure, which is going to be really good for your training. And then in terms of EMS, we're lucky that AdventHealth has one of the largest inter-hospital transport systems in the country. And so our residents during their second and third year get an experience of working with them. And then also Winter Park Fire Department is a local 911 agency that our residents rotate with their second and third year as well.
Okay, great. What would you say your residents say the best thing about the residency is?
It's funny. We just did a poll for this, and kind of across the board, it's the one-on-one with attendings. We're a very busy community hospital. We see over 85,000 visits. We have 9 attending shifts a day, and basically with every resident, you're with one attending, and so it's one-on-one education. Occasionally, there might be a second resident for a couple hours, but most shifts that you're working, it's you and one attending, where you guys can work side by side, educate side by side, and take care of patients side by side.
Okay, awesome. Would you say that you guys have a tight-knit program? Like, what do you do outside of working that keeps you
Mhm.
guys close?
Yeah, I mean it's a mix of, the stuff that's mandatory by ECGME, which is, quarterly wellness days, whether it's going to Disney, Universal, doing a night out at Top Golf. And then on top of that, our residents, they do wellness Wednesdays, which is one Wednesday a night. One of the senior residents hosts all the residents over at their house. It turns into a big potluck. And then on top of that, we have very close-knit classes that attend conferences together, which is always fun. And then at the beginning of the academic year, we take all of our seniors to FSEP.
Okay, awesome. So do you guys give funding for those opportunities, or the residents pay out of pocket for this?
No, wellness activities are all covered in our budget, and conference travel when we take a class or take numerous classes are all covered by the program.
Okay, great. What are you looking for outside of, like you said, the tailoring the application to EM in your applicants?
It's just really good people. I think a lot of people focus on the numbers, which are board scores and slows and grades, and those are all very, very important. But at the end of the day, I'm a firm believer that our program can take any decent human being and make them a very good emergency physician. So just things that show that you're interested in being a good human being. So community service, a good story from your family, you have hobbies outside of the hospital. So again, trying to be as well-rounded as you can, because those things are going to help prepare you to kind of last the drudgery that is EM residency, regardless of where you train.
Okay, great.
Yeah.
And would you say that residents at your program get a lot of the experience to do like reductions
Mhm.
and intubations, or are anesthesia ortho coming in and doing stuff like
Yeah,
that?
no, we're lucky to where within AdventHealth, there are three main hospitals that have GME. So it's us, AdventHealth Orlando, and AdventHealth Winter Park. But our residents, because they do all of their emergency medicine here at AdventHealth East Orlando, except some electives, there are no other learners in house. And so all intubations, reductions, procedures, central lines, chest tubes, those are all done by our EM residents with attendings. And that's a kind of a cool thing we get to do.
Okay. And where are most of your graduates working? Are they going to fellowships? Are they working community, or what are they doing?
Yeah, so I mean, we look at demographics, 50% stay in Florida, and then the other 50% kind of go home wherever they're from. And then in terms of fellowships, recently there's been an uptick in the number of people doing fellowships, particularly EMS and medical education. And then when you look at where our residents work in terms of demographic, it's mostly in the community, but we do have a number of people that work in academics. One of our one of our graduates was faculty at the Osceola program and is now starting a new program in Tampa. The current program director at Osceola UCF is one of our graduates, as well as a couple other faculty as well. So we kind of have people going everywhere, but we have seen an uptick in people going into academics.
Okay, great.
Yeah.
And then how long are you spending in each elective throughout the curriculum, I guess? Is it
Yeah, so
dependent?
so we do the typical 4-week blocks. So it's 4 weeks of OB, 4 weeks of ortho. You get 8 weeks of dedicated medical ICU, your PICU month, and then you get a trauma ICU month. You get an additional 2 months of trauma, and then you get some elective time where you can kind of pick what you want to do. Usually, our residents do either an extra ultrasound month or they do another critical care month. And then I'm trying to think what other. Oh, and then you do your month of anesthesia. So just the 4-week blocks.
Do you have any sort of like track that residents can choose at the beginning? Maybe that they could have like an advisor in or something like that?
Yeah, so we've recently launched a medical education track because that seems to be a thing that a lot of our graduates are going to do, and we're in the process of building an EMS and an ultrasound track as well.
Okay, awesome.
Yeah.
Have there been any recent changes, I guess, besides that to the program?
A recent leadership change. One of the founding faculty members, Dr. Nazario, was the program director the previous 4 years, and he stepped down, and I've been the program director since July. Other things that are kind of coming down the pike is we're just trying to move rotations to be in the right parts of the curriculum to get you the best exposure. The biggest one being we've moved EMS from third year into second year, and then we're also trying to tweak how do we maximize and get the most of our critical care rotations. And so we've recently re-added a new critical care month that is again in a place where you're just you and the critical care attending, rather than being on a team with a critical care attending, a fellow, and then a couple other residents.
Okay.
Yeah.
What is a message that you want applicants to take away from your program?
If they're looking to train at a high acuity, um, a low attending to resident ratio in a great city that is Orlando, this is the place you should come because you're going to get again great hands-on teaching, more procedures than you can even log, and then you're going to get a great education.
Okay. Are there a lot of advanced practitioners, like PAs, NPs, things like that, or is it mostly you're working intern and attending?
So whenever you're whatever space we work in the emergency department, there is a dedicated fast track that is staffed by our APPs that our residents will get involved in procedures for those cases. But otherwise, the other 68 beds of our emergency department are just staffed by attendings and residents.
Okay,
Yeah.
awesome. I feel like we've covered so many questions.
Yeah.
I guess another one is, does your program allow moonlighting?
So we do, and our residents, we typically let them moonlight their third year. You've got to be in good standing, which is you got to have your research done. Your logs have to be up to date. You have to have performed well on the ITE to where you're not on an education plan, because again, we want you to pass boards. But if you meet those requirements, you can moonlight. Most of our residents, there's some local urgent cares that our residents moonlight in that we haven't had any problem getting them connected with.
Okay, awesome. And is there anything else you would like medical students applying to know about your program?
I want to stress the fact that, if you like Central Florida and you're interested in being in a community hospital setting where if we have a county population in terms of we have patients from all walks of life, and then again, get that hands-on one-on-one education, this is the place you should want to come.
Awesome. Well,
Yeah.
thank you so much. You
Yeah.
answered all of my questions. I'm gonna stop the recording
Yeah. Cool.
here.